those things. So brushing should be after meals.
Okay.
Right? So in the morning, you wake up, take your breakfast, then brush. In the evening, you take your dinner, and then you brush.
You brush.
Yes, before going to sleep. It should be the last thing you do before going to sleep. Yes, so that you sleep with your mouth clean.
The last thing you do is you leave the house?
Yes.
And the last thing?
You do before going to bed.
To bed.
Before retiring to bed, yes.
That's new. I hear you are saying something.
So, yeah. So here I have a model with me.
Yes.
So it is just a model of a mouth.
Okay.
The way a mouth looks like. Of course, this is an adult model.
All right.
With a full set of permanent teeth.
Okay.
So most people just brush the surface that is being seen by people.
Okay.
Because you don't want, when you smile, people are seeing that. So most people concentrate on brushing the outer side.
Okay.
But as you can see, teeth have different surfaces.
Okay.
So there is the outer surface, there is the inner surface, right? There is the biting surface, and there is the inner surface towards the tongue.
Okay.
Right?
Yes.
Then you also have the tongue here.
All right.
So how do you brush? First of all, you should use the proper brush.
Okay.
There are people who use a very hard brush, and that, as we are going to probably talk about it, can cause damage to the teeth and the gum. So you are supposed to use a medium brush, not very hard.
Okay.
Then the other thing is about the force. You are not scrubbing the floor. I mean, you are brushing your teeth, right? So there are people who brush their teeth. You can hear them from the sitting room and in the bathroom. You know, that is wrong. Number 3, it's about the technique. Which technique do you use for brushing?
All right.
So if I may just try to demonstrate.
Yes.
So with your brush like this, I know most people when you are starting brushing, they just do horizontal strokes like this.
Okay.
All right.
Yes.
So this is not recommended. You know, doing. You know.
But that's the normal standard procedure.
That's why we are demystifying these things, right? So what you're supposed to do is you, of course, get your brush, nice brush, medium, put your toothpaste.
Yes.
Toothpaste, you can use any, all right?
All right.
Then you can start from the back.
Okay.
The motion that we prefer and we recommend as dentists is circular motions.
Okay.
All right? So you don't do like the way you polish your shoes.
All right.
So you just roll your brush. So you angulate your brush towards the gum.
Okay.
Because there's usually a space between the tooth and the gum.
Okay.
There's a pocket there. And that's where most of the dirt hides. So you angulate your brush at around 45 degrees, like that.
Yes.
And then you do circular motions. All right?
All right.
You do circular motions. The most important, I mean, the reason why I recommend that is some of the bristles, as you can see, will brush in between the gap between the tooth and the gum.
Okay.
And it will get out all those things. Okay. So you do that for the upper teeth. You also do the same for the lower teeth.
Yes.
So, of course, angulation for the lower teeth is downwards.
Okay.
Yeah?
Yes.
You brush like that. The same thing on the
other side.
On the other side, that. Then now, still on the back teeth, now you brush the biting surface where we have grooves.
All right.
So you make sure that now you brush each of the teeth, right? Yes. On all surfaces.
Okay.
On the inside, you know, the biting surface. Then where most people don't bother is the inner part of the teeth.
All right.
All right. So on the inner part of the teeth, also do the same angulation and some strokes on the inner surface of the teeth on all sides. Then from there we come to the front teeth.
Okay.
So for the front teeth, again, you can do the rolling motions, or you can even do the like strokings, vertical strokes.
All right.
On the teeth. Just make sure you don't use a lot of force. Okay. The reason why we don't recommend the horizontal strokes is that you'll be cutting across the gum.
Okay.
And the gum is soft tissue.
All right.
So sometimes you may find that if you use a lot of force over a long period of time, the gum starts to run away from the tooth. It's called gum recession.
Okay.
So it's usually because of the abrasion of the teeth.
All right.
Then, of course, once you finish with the outer surface of the front teeth, also again on the inner surface of the front teeth, both on the lower side and the upper side. From there, rinse your mouth. Okay.
All right.
So once you rinse your mouth, rinse your brush. Okay. Once you rinse your brush, now the other part that people forget, the tongue.
Okay.
You need to brush the tongue, because also it gathers a lot of dirt.
True.
So you brush it. You can either use your brush or use something called a tongue scraper.
Okay.
And like we said, brushing basically is disintegrating the plaque or the food accumulation of food on the teeth. So it doesn't have to be a commercial brush. You can even use those twigs. So long as, I mean, you are just cleaning, they are very effective.
All right.
So it doesn't have, you don't have to give an excuse of that you can't afford a brush. But if even those zinaitangwa mswaki, zile za miti.
Mda.
Exactly. So those ones